What steps do you take to ensure patients feel heard and confident throughout like their journey and journey with you?
So, I mean, everything starts from the first phone call, right? When somebody finds you on Google, they're going to decide to either call you or email you. So, we do try to stay on top of the response kind of as immediate as possible. We've incorporated over the years, like most recent years, a little bit of that AI integration with the chatting option on the website. I think there's still a lot of things that are missing, right? That we're going to slowly incorporate this year now that there's more things available
Mm-hmm.
to automate systems. But I think at some point, too, people still like that human connection and they have complex questions that I'm not sure if technology is just right there yet, right? Practice that provides multiple services. So there's just so many different things that you could ask about, could ask simple things about scheduling or pricing, but then what should I do for my acne scars? Yeah, I don't know. You might need a human to say, hey, these are some options that we have for acne scar treatments, but you still need a medical consultation to determine the best treatment for you because there's other considerations, right?
Based on the history and other things.
Correct. Skin type even is also important to determine, well, what device am I going to use? And like you said, medical history, what other products are they using? Maybe they need to stop certain things before they come in for treatment and so forth.
And patient expectation has changed over the past few years, right? That especially with the rise of social media and instant results. What's your view on that?
So, right. So back to the patient experience is the first thing is, that initial contact. So where I was going was we have a designated person that answers all the new patient calls. That is her only job is to take new patient calls and to give them whatever information they need, take that time on the phone with them to manage that call and convert it into a booked appointment, right? A booked consultation. We used to have that role as part of the front desk. And the problem is that when you are a very busy practice,
Mhm.
there's people checking in and checking out, and somewhere in between, those front desk people need to also answer the call and give patients enough attention over the phone to be comfortable booking that appointment. It's a little bit harder just naturally as a person. If you're busy and you have somebody right in front of you, you might just opt in to say, yeah, our Botox is $14 a unit. Okay, thanks, bye, rather than really engaging with that customer over the phone and being able to convert them into a booked appointment. Because you don't have
Yes.
to talk about specials, you don't have time to talk about maybe a different provider or well, what do you need? Or just whatever it is. You don't
Correct.
have time for that if you're doing too many jobs. I feel like once we created that dedicated person, it really made a difference for the patient experience.
So do you have some sort of an automated service or is it really a person right now at the front desk working with
Yes, it's just a person right now. I've been looking into a few options,
you?
a few softwares. One of them is going to be part of our current electronic medical record system, which is a little bit more than just an EMR. It also has marketing capabilities, and they just built out an AI answering service essentially that's supposed to help communicate with patients when we're not, off business hours or when you really want to pay to communicate because you're paying for the time that you're activating that AI robot. So